Great, welcome. I'm here with Dr. Howard. Dr. Howard, would you like to give a just brief introduction of yourself and your work?
Sure. My name is Cindy Howard, and I've been here in Minnesota for about 15 and a half years now. I moved from Maryland. However, I'm originally from North Carolina. And I moved from the East Coast here to St. Paul with my twin daughters for two reasons. The first reason was because I was interested in finding a place where my girls could grow up and have a public education with a diverse group of kids. My girls are from the Democratic Republic of Congo, so they're Black and I'm white, and I came out looking for a job, actually was recruited to the University of Minnesota to help build a track or focused curriculum in global health for the pediatric residents. So I was very interested in the job, but even more so in finding a place where my girls could grow up with a larger community, and it's been a good place for us. Prior to coming here, I worked in Baltimore. I was at the University of Maryland for 14 years, and then prior to that, I was in Nigeria for 4 years, and several other places prior to that time. So Tulane and Berlin, Germany. So I've worked in several institutions throughout the world, and have thoroughly enjoyed being a pediatrician. So for all of you who are thinking about medicine, you have to think about peds, especially if you love kids.
Yes, thank you. Going on to some of our sort of questions from the general members too. So what got you interested in pediatrics? Like, why do you think it's so special? Like, how does it tie into how you picked your specialty of doing pediatrics with like a global focus as well?
Oh, sure. Well, when I was growing up, I lived next door to two nurses, and one of them, Miss Harkey, told me when I was in the third grade, I guess, that she thought I would make a good pediatrician. I don't know why, but perhaps she planted that seed in my head. But as I grew up, I realized that I really like science. I love biology and chemistry, and of course, part of that was just having excellent teachers as I was coming through middle school and high school. But I found that every summer, my job interest gravitated towards kids. So I worked at camps or playgrounds, coached softball, that kind of thing. And so I thought, as I moved closer to college, I started thinking, how could I put these two interests together, science and kids? And I thought, oh, maybe Miss Harkey was right, maybe pediatrics. So I guess I was a rising senior in high school when I definitely decided that I wanted to go to university as a pre-med, and thought that I would probably end up in pediatrics. It was about that time too that I began to think a little bit more about global health, and I can tell that a little bit about that story too if you would like for me.
Yeah, for sure.
Yeah, so when I was 16, this was 1969, so it was the summer when the United States landed on the moon. So it was a landmark year from that standpoint. I was working at a camp for girls in Asheboro, North Carolina, which is in the foothills of North Carolina. I was working there as a lifeguard, and had the opportunity to hear a surgeon from Wake Forest University. So there are 4 medical schools in North Carolina. Wake Forest is one of them. And this camp was close to Winston-Salem, which is where Wake Forest is located. So Dr. Pennell, who later became a mentor for me, came to camp one evening to talk to the kids about his work as a surgeon with Kenyan colleagues, and talked about his time in Kenya that year. And he told us that there were a number of families who could not access health care, whose children actually were dying from preventable diseases or diseases that could be treated. And as a, high school kid interested in medicine, I walked out of the lecture that night just thinking, this is what I want to do. I want to be a pediatrician in a place where doctors for kids are needed. And at that point, I didn't realize that place could certainly be in the United States. I was thinking more broadly. I didn't realize that kids in the United States didn't have access to health care at that time. But my sights were set on working abroad. And then as a medical student, so I stayed in North Carolina for undergraduate and also for medical school. I was at Chapel Hill. I wasn't at Wake Forest. I was at the University of North Carolina, Chapel Hill, but Dr. Pennell became a mentor for me during that time. And I decided between my junior and senior year, he encouraged me to do this, and I took him up on it. I went to work in a UN refugee hospital in Gaza City, so in the Middle East, and was there in the Middle East for 3 months. And it affirmed for me that really helped me to be certain that I wanted to go into, back then we would say, international health. Now we, of course, fortunately, are focused on global health. But it was at that time that I certainly made definite plans and began looking for residency where I could do not only pediatrics, but hopefully have at least some peers, colleagues, faculty who are also interested in international health. And I went on to residency and then continued at my course in global health.
Sort of backtracking a bit to, I guess, maybe your college career, like undergrad, just talking about your journey to like applying to medical, things like that. We have a couple questions like about like how many medical schools you applied to, if you took a gap year, like would you recommend taking a gap year, those sorts of things.
Sure. Yeah. Well, I went to the University of North Carolina at Greensboro. So there's 17 different branches of the University of North Carolina. In fact, my twin daughters are there now as freshmen. And this was a good place for me. It was about an hour and a half from home. It's certainly grown since then, but it was a fairly small campus at that time. And I was a biology major, chemistry minor, had wonderful faculty who encouraged me. And I loved undergraduate years. I loved everything about being an undergraduate, and I hope all of you do as well. It's such a wonderful time, not only to learn a lot and to be with people who are equally motivated, but also to make good friends and have a good time. Hopefully, when this pandemic is over, you'll have more freedom to be together in person. But anyway, I applied for medical school my junior year. So I finished my undergraduate when I was, it was middle of the year, my senior year. I had enough credit. So I went ahead and started a master's in biology as I was waiting to see if I would be accepted into medical school, because I thought I'll teach biology if I don't get accepted and apply again. And I'm trying to think, I think I applied to 4 medical schools, which was what most of us did back then. These days you apply to many more places, but back then I think at least most of the folks I knew, we just applied within our geographical area. So I applied to the University of North Carolina and East Carolina University, which was a 1-year medical school. And then from there, one would go to the University of North Carolina, Chapel Hill. And I applied to Wake Forest and to the University of Virginia. And I was accepted at East Carolina University before I was rejected at all the other medical schools. So I went ahead and went to East Carolina. And at the time I was a little bit, I felt a little bad about it. I thought, gosh, I'm going to this 1-year medical school, and I guess I just wasn't good enough to get into, Chapel Hill right away or Wake Forest. And I got there, and it was a wonderful experience. There were 20 of us and 14 faculty. So we learned so much. And by the time we got to Chapel Hill the next year, I think we were ahead of most of our classmates. And we were very, very close. It was another special time that first year in medical school. We often ate dinner together and studied together. And then from there, we all went to Chapel Hill. And we're actually having a reunion this year. It's our 45th reunion, I think. So, yeah. So that'll be fun. And we've kept up with each other. A few of us have kept up with each other, but it'll be fun to see what everyone else is up to.
Yeah, that is really sweet. That sounds like a very unique experience.
It was really unique. Yeah.
Yeah, like I know personally, and I'm not sure if many of our audience members knew as well, that like a 1-year university is a sort of option. Like I've never heard of sort of like that, where you like go there for a year, then go to a different school.
Yeah, it's a little bit similar to the University of Minnesota in that it's possible to go to Duluth for 2 years, and then all of the Duluth students come this way for the 3rd and 4th year. And I think Duluth does a great job. I mean, I think so I'll put this word out there. We have a wonderful medical school. But if you love the North, and for me, I like a little smaller, group of students. I like to know my faculty really well. I would certainly think about, applying to Duluth, as well. And there's quite an emphasis on Native American health, rural health. And I think, either place you'll have a very good preparation, 1st and 2nd year.
Sort of fast forwarding now again to like sort of the present. Someone has asked, in what ways has COVID-19 impacted your work, or maybe just the whole area of sort of like pediatrics and global health especially?
Sure. Yeah, that's a great question, and one that we keep asking ourselves as well, and trying to help each other, those of us who are in global education here at home and also abroad as well, to learn how to do better. But first of all, the most I guess evident effect that COVID-19 has had on our program. So we have a global pediatrics program in the Department of Pediatrics, and I'm the director of the program, and so I oversee this great faculty who focus on education for the residents, and that includes pediatric residents and residents who are studying adult medicine and pediatric medicine as well, and research and advocacy. So all of our residents have the opportunity. So we have 75 pediatric residents. It's a 3-year program, and they are all welcome to join the global pediatric track. So we have monthly meetings. We have various educational opportunities throughout the month, and then we have online curriculum, which our residents must complete to receive a certificate in global pediatrics. Part of that training is also doing at least 4 weeks of a global elective, which can be here at home. It can be in global advocacy in Washington, D.C. on the Hill with the American Academy of Pediatrics. It can be at Rosebud, a Native American community in South Dakota. And then we have 6 international partners. We're sort of Afrocentric because that's where our faculty has longstanding relationships. Mine personally are in Nigeria, where I lived, and in Uganda, where I have worked for the last 15 years or so. But our residents this year and our faculty as well, of course, have been unable to travel. And it's not just that we can't travel, but our faculty and residents from our partners cannot travel this way either. And interestingly enough, our friends in Africa are doing much better with COVID than we are here. And so part of the challenge is for us to make sure that we don't take COVID to another part of the world. And so, of course, we follow the travel restrictions that the university and President Gable are outlining for us. But one of the biggest effects has been the impossibility of traveling safely. So that's one thing. And then secondly, we have been challenged in nurturing our partnerships, abroad, whether it's in research or education. So we're working, for example, in virtual education with our partners who are in a fairly close time zone. So our strongest partner in this hemisphere is, and our only educational partner is St. Damian's Children's Hospital in Port-au-Prince, Haiti. So it's the only freestanding children's hospital in Haiti, and we're part of a collaborative in North America to support, particularly with subspecialty expertise, St. Damian's Children's Hospital as they build up their own subspecialists. And so we share a virtual curriculum with them in critical care medicine, and we just had a fundraiser for them last week. It's more difficult with our partners who are in different time zones to actually share curriculum. So we're working together in areas that we can, for example, doing literature searches together, writing papers together, brainstorming for the future, trying to support each other from an emotional and mental health, standpoint, and just, nurture our friendships. So there's that piece of it that's looking outward. Something that has been perhaps more difficult, necessary, and unexpected has been looking inward, looking at why we were so unprepared here in the United States. We've focused quite a bit in global health with our adult colleagues and thinking about how to help the public know the truth about COVID-19 and how to protect themselves and depoliticize the message. And we've certainly been active in registering, and my guess is that AMSA has as well, registering voters and trying to be politically active and politically active, supporting Biden and Harris. One of our major points for our residents and our faculty, and when we talk to friends and others, is that we cannot afford to leave the World Health Organization. Yes, we are an important member, but we also need what WHO can give to us. We need to share medical public health information with our colleagues all over the world. So we've been very active in the election, primarily with the guidance of the American Academy of Pediatrics. And then following the murder of George Floyd right here at home, our whole department has really looked inward and said, how can we be anti-racist? So we're all required by our chair to read Dr. Kendi's book. We're having 3 sessions as we look at this book together, look at ourselves personally and as a group, and understand and learn how we can transform medical education as well as our clinical practice so that we are anti-racist in what we do. Those efforts have also spilled over in global health here at the University of Minnesota, and also with our larger global pediatric group, which is called the Midwest Consortium of Global Child Health Educators. It includes us and Mayo, University of Wisconsin, Medical College of Wisconsin, Northwestern, Cincinnati Children's, and Case Western. And we're looking at how to decolonize our partnerships. And we're doing that in partnership with our colleagues abroad. So we're trying to understand, again, how we can change policy, change attitudes, strengthen our efforts to be culturally humble, and to do that, particularly looking at what's happening in the United States, how we participate in partnerships, and finally, how we can together decrease health disparities based on race or culture or socioeconomic status. So I think as tough as COVID has been, as dreadful as it has helped us to do some homework that we really needed to do.
So going along with sort of all of that, and like with going with future physicians obviously needing to like self-educate and to consciously just be aware of their biases and anything else that might be coming, are there any other crucial qualities that you might think that physicians of the future will need, and maybe specifically future people or future physicians in pediatrics and global health?
Yeah, sure. Well, first of all, in general, when you're thinking about what you're going to do, think about what you love to do, because in global health, any specialty, any subspecialty is valuable. So when I was coming along, for example, it was you either had to be a surgeon or you had to be an infectious disease specialist, it seemed to me. And I learned, no, you can, and it's even more so these days, any specialty or subspecialty is valuable in global health, in clinical care, in education, in research and advocacy, in any of those areas, it's valuable. So I think what's most important, is to take one step at a time, one day at a time. And first of all, just simply be the best doctor that you can be. And that includes not only medical knowledge, but learning to communicate with your patients, learning to communicate with your team, learning teamwork. Many of you probably play sports, or perhaps you're on debate teams, and medicine is teamwork. So enjoying being on a team and taking those skills and the esprit de corps that you have, on other teams in your life to medicine is a good place to start. So when you get into medical school, the first 2 years, especially here at Minnesota, tend to be medical knowledge heavy. But by the time you get there, already in other medical schools, but working on this here, you'll have more of an opportunity to develop those skills that are not just knowledge, but also communication skills. Having an attitude of humility is very important for us as physicians. On the one hand, we have lots of power as a physician. We have lots of power in the lives of our patients, especially in pediatrics. Our little patients really look up to us. They want to be us, many of them. And so there's quite a bit of power there, power politically, power in helping communities to be healthy. But along with that, cultivating a spirit, an attitude of humility, an attitude of curiosity, especially in not only across cultures, but in all of our interactions with our patients, listening to what they teach us and tell us about themselves. So then there's developing a professionalism as you're, going through school. Again, it's a privilege to be a physician. It's a privilege to take care of someone else's body, mental health, physical health. And I think it's even more of a privilege to take care of their children's health. Of course, I'm a pediatrician, so I'm a little bit biased about that. So I think, just try to be a really well-rounded person. Try to stay in good health, yourself from a physical health standpoint and a mental health standpoint, emotional, spiritual health standpoint, be physically active, nurture your friendships, study hard, but also maintain that sense of curiosity and imagination about how things can be better than they are now. So there's, we certainly have a social contract with our communities and with our society as physicians to, in general, make public health a priority and to improve it for everyone. So I guess, that's a lot, Catherine. Take one day at a time, and also remember that life is not a single trajectory. I'm on the other end of my career. You guys are just starting. And I look back at my life, and when I was your age, I thought everything was a single trajectory. Well, I became a parent of two of my patients when I was 50 years old. They're now freshmen in high school. So you just never know where life is going to take you. So I think, be open to new experiences and to learning all the time.
Sort of going a little tangentially, but also still along that sort of line with all your experiences that you listed before. They've worked in a lot of different countries and lived in a lot of different places and have done extensive work in sort of the global health field. Is there anything that you've noticed that you think physicians in America could learn from physicians in other places in the world?
That there's so much that we can learn. That's the best part, is learning from others in different parts of the world. Here in the United States as well, we have so much to learn from each other in different communities. I've been amazed. I had no idea when I moved to the Twin Cities that there are so many different immigrant communities here. And I learned so much from Somali colleagues, nurses and doctors and Hmong physicians who I work with or interact with in the community. But one of the best things about traveling as a physician and working with colleagues abroad and having colleagues come this way is learning how to do things a little differently, learning often how to do things with much less money than what we spend here, learning how to think about disease in a little different way than how we usually think of it, and being open to thinking about disease from a little different standpoint than we typically do, and learning how to everyday things, certainly, like communicating in another language. Of course, we do that here at home, but when I'm in Uganda, it's always amazing to me because there are over 200 languages in Uganda. And so when a medical student is assigned to a patient, not knowing what language that patient speaks, the medical student will have in their cell phone the numbers of their classmates who speak all different languages, and their classmate will come over, and help interpret for them so that they can interview the patient. But just learning to do, with what you have. We really enjoy working with colleagues who, in making different devices, like making something called bubble CPAP that helps babies to breathe, and doing it for a fraction of the money that we do it here. making ventilators at low cost, making oxygen concentrators at low cost, making Billy lights. If you're familiar with babies being jaundiced or being yellow and having to be under a bank of blue lights, learning how to do all of those things, chest tubes, with fewer resources than we have here. So, learning how to be mindful of resources, using them effectively, recycling, teaching. Some of my colleagues at Makerere University in Kampala are some of the best teachers that I've ever had the pleasure to work with, and often teach in a way that's, I think, better than how we teach here. Not always, because there's still a little bit of fear on the part of some professors, to really push students almost to tears, which we don't do here. We would get in trouble, at least at Minnesota, for doing that. But for the most part, there seemed to be, I guess, an extra dose of teaching skills that my colleagues in Uganda have been received, have been blessed with. So I learned to teach better when I'm over there. I learned to work with fewer resources when I'm there. I learned to be more efficient when I'm rounding. I learned how to communicate better across cultures. Learned to laugh at myself. I learned how to improve my differential diagnosis. So when you're confronted with a set of signs and symptoms that a patient has, what is coming up with a list of all the possible diseases that might be. And so I always come back, not to mention doing a better physical exam, because when you have fewer lab tests and you have fewer options to image, you have no MRI, you have no CT scan, then you learn how to be a more astute physician in doing your physical exam. And that is a valuable skill to have.
Amazing.
And then it's just fun. Lots of good food and lots of laughter and just both places that I've worked. Well, there are 3 places that 4 places that I've worked. Well, 5, I guess. I've lived in Germany, lived in Nigeria, spent a lot of time in Uganda, and then those 3 months in the Middle East. And I had a month in India in between residency and work. And every culture is just so beautiful on its own. And I have enjoyed the food. I've enjoyed learning how folks treat each other and brought that home with me. When I was in Palestine, I was so amazed at how hospitable people are. Just the level of hospitality was something that I had never witnessed before. And so, yeah, talking with you makes me want to travel again. So hopefully we can within a year or so.
We have another question here. It says, have you read The Body Keeps the Score, which is a book, I believe, by Bessel van der Kolk? If so, or in what ways do you think our medical system is succeeding in serving traumatized kids, and in what ways are we failing?
Oh, I haven't read the book, How the Body Keeps the Score. Yeah, but I certainly will. Thanks for that recommendation. Well, I don't think we're doing a very good job treating children who have been affected by trauma. And I think we realize that as pediatricians, and we're trying to to address what we need to know on many levels. So we are learning more just in the last year. This is such a great question, but just in the last year, we've begun to focus more on learning to do trauma-informed care, and which I guess we know a little bit about just from experience, but we're learning, again, through teamwork with our developmental psychologist and our child psychiatrist and our child psychologist, how to identify a child who has been through physical, we're pretty good at physical trauma, but emotional trauma, and how to be present to the child and how to help the child to recover. So most of my experience has been with internationally adopted my own children are internationally adopted. And we know that many children who end up in orphanages are traumatized in various ways. The trauma may be as simple, but as potentially devastating as simply not having one adult in their life, the first year of life, who is theirs and who they can attach to. And so that is where most of my experience has been in working with adoptive families who are in the process of attaching, and so this is a basic lesson that we learn, providing a safe place for this child to grow up. So that's been most of my experience, but we're learning more about the needs of foster children in Minnesota. There are about 10,000 foster children in the state of Minnesota. Many have been transitioned from one home to another, very traumatic. And so we're learning more about how to provide care for them. There are so many needs. There are the needs of undocumented children who worry every day that their parent will be deported. There are undocumented children whose parents are incarcerated here in Minnesota. There are refugee children who have seen terrible things and have they've left behind their home. They've often been through many countries, and getting here, they perhaps have had various diseases, perhaps physical trauma. Perhaps they have been separated from their parents. So I say all this because there are many children who have suffered trauma. And COVID-19 is traumatic for children, period. Even in a stable, loving, safe family, not being able to go to school, not being able to see their friends. Kids who, yes, they could be doing virtual school, but they don't have a computer, or they only have one, and they're 5 kids, or they don't have internet access. So there's just many opportunities for trauma, and then there's electronics as well, which can be traumatic, and social media with cyberbullying and that kind of thing. So in answer to the question, we're behind. We're trying to catch up. One area that is, and that some of you might be quite interested in, is mental health, which may not be an MD. It may not be psychiatry. It may be a PhD, or it may be a master's, or it may be a licensed social worker who is skilled at listening and helping children to make their way toward good health and toward healing. So it's an area where there's lots of research going on. There's lots of education. One of the areas which we really need to focus on, because I think we know what to do. But one area that we really need to focus on is building capacity in our own country, building workforce capacity of people who have the skills and the passion and the love to do this kind of work. So, so that's certainly an area to think about. And I appreciate the recommendation on the book. I'll not only read it, but I'll share it with others as well.
Thank you so much. It looks like we're coming up around 45 minutes here. So I guess we'll just start doing a little wrap up and just ask if you have any sort of final parting words of advice or anything for anyone that might be listening.
Well, I would say, first of all, keep looking at the light at the end of the tunnel, this year, as well as medical school, when you get to that point. Some of you are probably juniors or perhaps even applying for medical school this year. So, keep your eyes on your goals, first of all. Don't give up. Secondly, nurture friendships as best you can during this time. It's so good that you're getting together in community, even online, as pre-med students, so that you can just encourage, one another and lift each other up, during this time. And then finally, I would say, enjoy studying, have fun, stay in touch with yourself through school so that you know what gives you joy, and head toward a career that you can do and can't believe that you get paid for. So I love what I do. I spend too much time on the computer these days, but I still do inpatient hospitalist work. I don't do outpatient anymore. But I love especially clinical care, and I love teaching medical students and residents too. And I still can't believe that I get paid for it. It's a good thing I get paid for it, especially with kids in college. But that's what I would hope for each of you, that you not only take great care of patients, whether you go into, whether you become a physician, a pediatrician, a mental health specialist, a neuroscientist. The university is building the Institute of, what is it? It's the Institute for Child and Adolescent Brain Development on the old Shriners Hospital campus. Lots going on there. I mean, if any of you are interested in neuroscience, that might be a place to look for, like an internship. It's supposed to open, I think, in the fall. But psychiatry, psychology, some of the leading neuroscientists in the country are going to be there. Damien Fair is a MacArthur Genius Award winner this year, and he's the director of the whole thing. So there's a lot of good things happening. And I would just say, keep your antenna up for what you love to do, and get your feet wet, doing it. And last time, I think I spoke in person to the pre-med group, the AMSA group, and I had hoped that those interested in pediatrics could do an observership, but it didn't work out. But if anyone is interested in just connecting and talking about pediatrics, Zooming, or over the phone, I'm happy to talk with anyone about that. And just wish everyone the best. And thanks for you're a very good interviewer, Catherine, and thank you for this invitation.
Thank you. All right. Thank you for speaking with me today.
You're welcome.